cut your skin, platelets gravitate toward that and stop the bleeding. But these platelets have a lot more potential. So when they're activated with this process, you sort of release the growth factors comparable to a seed to a plant. When you put the seed into the soil, the plant grows. So when you do the activation process, the growth factors are released, and that's where the real healing potential comes from.
Hey guys, what's up? It's Jeff Winchester in the Catching Clinic, and I am joined today with Dr. Kevin Darr of Covington Orthopedics, and we've got a really cool topic to talk about today. The general population is pretty well aware of an injury called Tommy John surgery. The player winds up having a problem or a pop in the elbow, and they have to go in and they have to do some reconstructive surgery and whatnot. But when it's all said and done, there are grades and levels of this type of injury, and sometimes if you catch it early enough, you may actually be able to stave off the surgery and do something a little bit more conservative in order to try to avoid having to have to go through the trauma of a surgery. And Dr. Darr is one of the Gulf Coast's leading experts in PRP, Platelet Rich Plasma. Dr. Darr, I do want to thank you for taking time out of your day. I know you're a very busy guy, and I'm excited to hear a little bit more about some of this technology that goes into helping our players heal without having to have to go down the route of surgery. So give us a little bit of breakdown of what PRP is and where we acquire it.
Sure. PRP, or platelet rich plasma, Jeff, is concentrated growth factors and platelets derived from the blood. So we do a routine blood draw. We take about 60 cc's of blood from the arm, like a routine blood draw. We put it in a centrifuge, which we have over here. We spin it, we concentrate the platelets, and we activate these platelets. So platelets are almost like seeds that have huge potential, but they're dormant in our bodies unless we activate it with this process. So when we activate the platelets, they release these potent alpha granules, which have growth factors and bioactive proteins that can help heal soft tissue injuries, ligaments, tendon, muscle injuries, and also cartilage injuries like labral tears for the shoulder, meniscal tears for the knee, and also helps with osteoarthritis too. Can help slow it down and decrease the inflammation. So the blood, when we activate it, what we call platelet rich plasma, very potent healing potential.
So now we got some cool little props over here for the general public who really don't have an idea of what the platelet rich plasma really looks like. Let's
Yeah, so basically what we do when we draw the blood, we put it in a centrifuge of this machine here, and this is after we spin it, it concentrates the platelets and growth factors, and then we use this area of what we call the PRP. We draw it up in a syringe, take it in a syringe, and then inject it into different areas of the body.
Right.
So with this special patented process, that's the key to release this potent healing potential of a platelet. Now, a platelet is a cell in the body that has a lot of utilization. When you cut your skin, platelets gravitate toward that and stop the bleeding. But these platelets have a lot more potential. So when they're activated with this process, you sort of release the growth factors comparable to a seed to a plant. When you put the seed into the soil, the plant grows. So when you do the activation process, the growth factors are released, and that's where the real healing potential comes from.
So in general, basically what we're doing is we're taking the very best components of the body's natural healing process, which is the blood, and taking it out of the blood, concentrating it, and putting it right into the area that we want to heal.
Exactly, Jeff. And the beauty of it, it's your cells. It's not someone else's. It's safe. We've never had a complication like infection or rejection. So it's an ideal treatment. It's not a chemical. Like a steroid injection, they're used quite a bit in the medical community. Unfortunately, that's a chemical that has no regenerative capability or healing potential. Now, it does decrease inflammation.
Right.
The problem is you inject a steroid into a ligament that could lead to rupture. So with the platelet rich plasma, it's more holistic, naturalistic, and there are no downsides really with it.
Where are some of the common areas that you are treating with PRP? Elbow, knee, are there ankle, hip, or where are some of the applications?
All those. And in baseball players, I treat a lot of baseball players. You mentioned earlier the elbow is a common area. And as you said earlier, with ulnar collateral ligament injuries, when you have a full thickness tear, most of the time the Tommy John surgery is the right thing to do. But if we can catch these athletes earlier with inflammation, partial tears, even high-grade partial tears, I'm having a lot of success utilizing the PRP into the ligament. We also treat lateral epicondylitis, which is inflammation. Okay. A lot of baseball players get that, otherwise known as tennis elbow. Okay. We treat that also. In the knee, ACL injuries, partial tears to ACLs, patella tendonitis, a lot of catchers.
Right, I was gonna go there.
Patella quadriceps tendonitis.
Let's say a guy who's throwing a pitch on the mound. He hears a massive pop, he curls over. That's an obvious scenario where something traumatic happened to his elbow, okay?
Yes.
So if I'm a player that maybe potentially might be at the beginning stages of a breakdown, let's say of my UCL, okay? What are some common symptoms that a player may feel that it's not necessarily a pop where we're really feeling like that ligament explode, but there's something nagging that's going on here? Or is it a constant soreness that just doesn't go away over time? How does one just simply come to the conclusion that, okay, well, it's not, I can actually function, but every time I do move, man, it really hurts me. So how does one know or determine that I need to see somebody for what I'm feeling?
Yes, great question, Jeff. One is persistent soreness. Okay. That means it doesn't go away. It stays constantly and it doesn't improve. That's a concerning sign, and I'd recommend an evaluation. The other is only with activity. So in other words, when a pitcher or thrower, it hurts only during the game, but then it resolves pretty quickly afterwards. I think 1 or 2 games, not that big a deal, but if it's persistent and it's every time the player throws, that needs to get evaluated. Because the key is catching it early. A lot of the athletes wait too long, and if they come see me with a complete tear, we miss that opportunity to heal. So I'd encourage, if it air early, on the earlier side with elbow pain than later, because we can really jump on it early and correct it.
That makes a whole lot of sense, because once it's gotten to a certain point, you almost can't go back. But if you catch it early enough, you can actually treat it and make sure that you can stabilize it or whatnot. I mean, we don't want to get to the point where you're throwing through pain, and then pop, all of a sudden you lose function of your arm, and now it's really, really bothering you. So kind of a fine line between knowing when to go get it checked on and being a little too ambitious with going out there throwing. I mean, is that kind of where we're at?
Yeah, that's exactly where we're at. The other comment I want to make, a lot of these injuries occur because of poor mechanics, overuse, muscle and tendon weakness. So in addition to the PRP, I do muscle re-education with this technology called A.R.P, A.R.P, Accelerated Recovery Program, which is a high intensity direct current. So we do this in our office. We have these electrodes that we put on different areas of the muscles. They will contract over 500 times a second. So we're able to correct these muscle deficiencies, so help with their form, so it's less likely that the injury will continue to recur in addition to the PRP or growth factor injections. So we look at it from two different angles.
Right.
One is, therapeutic treatment, the biologics, and two, form change, muscle education, strengthening, and both those are really effective.
Yeah, I mean, you were showing me a video earlier of one of your patients that came through here, and I would love for our viewers to be able to kind of see what that whole process is all about. I think it's very educational.
Yes.
So we're going to have Dr. Darr kind of narrate for us a little bit of a video that we're going to see here right now.
So I'm here with Trent. Trent's a 16-year-old baseball player, local high school, who had an elbow problem. He injured his ulnar collateral ligament and a little bone bruise on the inside of his elbow. So we talked about options for Trent and some exciting regenerative techniques that I'm doing, what we call Platelet Rich Plasma. So what I did was we drew some blood from Trent's arm, we put it in a centrifuge, we concentrated the platelets and activated the growth factors in the platelets. And this is what the PRP looks like. We put it in a syringe, and then I injected on the inside of his elbow in the area of the ulnar collateral ligament and the bone bruise. Afterwards, we put ice and we rested Trent initially. After a couple weeks, Trent started the A.R.P technology. The A.R.P is Advanced Recovery Program, which is a high potency direct current program. It contracts the muscle over 500 times a second. So Trent did that. He did very well along with physical therapy. So Trent completed the program. Now he's 2 months out from the PRP and the A.R.P. And Trent, tell us about your experience and where you are now with the elbow.
Before the PRP and the A.R.P and physical therapy and all that, my arm was hurt for about 3 years after I got a fracture in my elbow, and then after that I came here and got my PRP and A.R.P, and I'm throwing again. I have no pain. I'm feeling great. So
Fantastic, Trent. We're excited to have you better, Trent, and hope you have a great baseball career. Thank you.
So this is Trent, and he's a pitcher at one of the local high schools here. And he came to us with an elbow concern. Dr. Darr had an exam with him and determined that this might be beneficial to him in conjunction with physical therapy, and that could be a case-by-case basis. So I have Trent hooked up here, and he's going to show you the type of exercise that we were doing. Again, he had an elbow injury, and the A.R.P machine, use it on different levels to increase his performance. So this is Trent, and I'm going to just show a little example of it. So, Trent,
So Dr. Darr, talk to us a little bit about what we're seeing on Trent right now. Take us through the technology that he's using to go through what it is that he's going through.
Sure. So Trent, we have electrodes around both of his arms in the area of the muscles around the elbow. And there's wires attached to it. So there's direct current that go through these pads that contract the muscle over 500 times a second. So during the process, the electrical current is going in, contract the muscle, and he's doing a specific rehab protocol that we put him through. There's specific exercises to help retrain the muscles, increase his mobility, increase his strength while he's having the stimulation. So it's a fascinating technology, and it works.
Awesome. In order to really kind of reconstruct and retrain the muscles, how Trent's going through this, take us through that process on maybe like a weekly basis on how this whole process plays out.
We do customize it to the athlete, but on average, it's 3 times a week and a 10-session package, so to speak. Okay. In other words, 10 sessions are a minimum amount that we use. Okay. A lot of times 10 is enough. Sometimes we do an additional 20. I've had one patient that we did 50, even 60 on.
Oh, wow.
But it's a few times a week, generally 3 times a week, approximately about an hour. They're in the office doing this treatment. Okay. So it's real one-on-one, very focused therapy.
I deal with a lot of catchers, obviously. If I had a player who had some knee pain, like you said earlier, patella tendonitis or some other area in the knee, would this application be suitable for someone who is struggling with some sort of pain in their knee?
Oh, absolutely, Jeff. Okay. Yeah, we use this in all different areas of the body. Knees, probably number one. shoulders, elbows, back.
Okay.
You know, it's excellent for back pain.
Yeah.
Hip pathology.
Okay.
I had a pitcher who had a labral injury.
All right.
Did a PRP on that pitcher, and A.R.P wave. He did terrific.
How long does it take if you've got a guy who's got a mild strain in his UCL and we're going to start a therapy session with the A.R.P? How long does that process generally take in order to get that player back onto a field?
Well, with the A.R.P, it's approximately 3 to 4 weeks. Now we can accelerate that. So it depends. If it's in season, needs to go back quicker, what we'll do is we'll accelerate that, and we could even do daily treatments, even sometimes twice a day.
Okay.
So again, we cater it to where the athlete is, what part of the season, and how they respond to treatment.
So there is a progression to it all.
There is a
Yeah.
progression, but
Right.
like I said, I customize it to each individual on that. Now, when you add PRP with that, usually my regimen is to give the PRP injection and then to start the A.R.P wave approximately a week
Okay.
to 2 weeks after the first PRP.
Okay.
Then we do 10 sessions of A.R.P. And depending, every athlete's at different degrees. Some are real severe, and I can repeat the PRP
Right.
to get that added effect of growth factors. So I'll go up to 3 PRP injections and 10, 20 A.R.P sessions in some cases to get, you know, the athlete back as quick as possible.
There's more and more evidence year in, year out that the PRP can help in actually healing, in the healing process.
Oh,
We're starting to
absolutely.
believe more and
And
more.
PRP is just one modality. I'm also using bone marrow mesenchymal stem cells and fat stem cells also to help with healing.
Mm-hmm.
That's exactly right. There's a lot of people come to me and say, look, they don't want surgery. They want more of a natural healing approach, and this is ideal. Also, I use it in conjunction with surgery sometimes to augment a surgical repair. For instance, a rotator cuff tear or even an ACL reconstruction. It helps heal the tissues quicker. And like you alluded to earlier, to try to prevent a surgery from happening, like in UCL injuries, you can get the PRP in there earlier, it heals, and you avoid a major reconstructive surgery like the Tommy John where they're out for several months.
Right. We really appreciate Dr. Darr and his time. I know he's a very, very busy man. And if you need to get in touch with Dr. Darr, maybe you have some potential injuries, what we're going to do is we're going to put his information in a link in the description down below. We'll also put the information for Covington Orthopedics on the on our website, on our Facebook page. And if you have any questions, leave your questions in the comments. We always go back, we check for comments. If people have inquiries about specific injuries, or if you just overall want some more information on that whole PRP process, let us know. Feel free to leave some comments and we'll get back to you as soon as we have an answer for it. And maybe one time we'll get you to come back and maybe we'll do a follow-up on
Sure.
it, and we'll answer some questions, and maybe we might do a live session where we can do more of an interactive situation.
Sure.
So this is Jeff Winchester with the Catching Clinic, keeping you caught up. So stay tuned. We got some more great things coming up. Thanks, guys.